Good morning and welcome to your Farm and Home Show. I'm Kristi and this morning we're visiting with Dr. Julie Marfell. She's an associate professor in the College of Nursing for the University of Kentucky. Good morning, Dr. Julie.
Oh, good morning.
It's great to have you here, and today we are going to talk about suicide prevention. Julie, what are some of the risks when facing suicide prevention?
Well, they're split up into different categories, and the first category is individual. And these are people who have social isolation, so they don't get out much. They work where they're not around a lot of people. We're here this week talking about farmers, and farmers are definitely socially isolated in their work most times. Sometimes they can have a serious illness. Of course, substance abuse could put you at risk for a suicidal thinking. So those are some of the individual pieces. Relationships, family histories, anybody that's been bullied. Also community and access to health care is a big risk factor. If people don't have access to health care, especially mental health services, that can put them at risk for suicide too. And then there's societal, which is stigma. And that's thinking that, oh, I can't talk about this, and we just don't talk about this in our family. And we're really trying very hard to get people to realize that we all have mental health wellness as something we need to take care of, and talking to people about how you're feeling is one of those pieces.
And I think it's so important that you are here today to talk to us about it, because we might have a loved one or even a coworker that is struggling with some of these issues, and we might be the person that can help them. Julie, what are some protective factors that we can take when it comes to suicide prevention?
Well, one of the things is just being able to have good coping and problem solving skills. And I think talking about that with each other, focusing on that with our children will help them as they continue to grow. Also, just thinking about some of your cultural beliefs. Some people are very much don't want to talk about it, and others are like, yeah, we need to keep you healthy. Also, just about your connections, and that's family, your friends, and also your community are very important as a protective factor. And really making sure that anybody that you're worried about does not have availability of any kind of a lethal source that they could injure themselves with. If you've got someone you're concerned about, our recommendation is to talk to them about it and ask them the question. Just say, are you thinking about hurting yourself? And if they say yes, then you say, let's talk about what we can do to help you.
Now, Julie, you are here helping with the Farm Dinner Theater program. Can you tell us about the program and how it got started?
Well, the program got started because of the wanting to decrease farmer suicide, because it is a number that is higher than we'd like to see. And farmers are amongst the top 5 of occupational problems with suicide. And we had the opportunity from a grant with the Robert Wood Johnson Foundation, the AARP Foundation, AARP, and the Center to Champion Nursing to be able to write towards it as a nursing innovation. We were funded. This is the first of our 2 programs that we're doing in the state, and we're thrilled. We are here a week. We're doing what's called QPR training for a group of high school kids, which I have to tell you, they are just absolutely fantastic. I've just really been so impressed with them. And what we're doing is teaching them how to ask the question, talking about stress reduction, and also then doing a skit at the Family Farm Theater. That was Dr. Debbie Reed. She's done them down here before for safety, and we're just taking this for mental health and wellness and suicide prevention. So I can't wait to see the performances.
It sounds like such a wonderful program. I can't wait to get to join tomorrow evening for
Yes.
the dinner theater. Now, Julie, if someone is watching or knows someone that they would like to get help, what are some resources or a phone number we can contact?
The first resource is the suicide prevention hotline, and it's a national number, and then they route you back to a local number, 800-273-8255. And if you know someone who is having problems, try to get them to help. It's the best thing you can do. You can save a life.
Thank you so much for being with us today.
Thank you for this opportunity. I appreciate it.
If you are watching and would like more information on suicide prevention, be sure to contact your local extension office. Thanks for watching and have a great day.